Arthroscopy means, arthro means joint, scopy means to see. So, to see inside the joint, it is called arthroscopy. Arthroscopy is commonly done for two joints. One is knee, second is shoulder. Okay, knee joint, commonly it is done for the arthroscopy surgery. Now recently we are doing for the shoulder also. Knee joints, we do this condition for ACL ruptures, anterior cruciate ligament ruptures, meniscal injuries, or some minor injuries to the cartilage can be treated, can be diagnosed by doing this arthroscopy procedure. Arthroscopy, basically it is done as a day-care procedure. Patient can come in the morning, do the operation, by evening they can get discharged. Then there are some specific exercises for this. Patients will teach them, will give them pamphlet, and they can follow this exercise regime. If they correctly follow this exercise regime, 100% recovery is possible.